you all know, if you're a regular listener to the podcast, that I'm very much in favor of taking a series of 6 digital photos as for our new patient, for patient education. And the simple reason is we all know that saying, a picture is worth
1,000 words.
1,000 words. So you can talk all you want, or you could show them pictures and they're going to get a lot more out of the pictures. So I think it's really important to take 6 digital photos for patient education for all of our new patients, Now, the missing ingredient for many practices is perhaps they've been persuaded to incorporate photography. They know at a core level that there's a value in showing patients photos. But rather than putting them on a tablet, displaying them on a tablet, they load those photos, onto their server, and they display them on a monitor in their practice. Today, most operatories will have 1 or 2 monitors, at least one, and often more. It's very easy, just upload the photos to your server and you can display those photos on the monitor. But the missing ingredient would be to just go one more step and upload those photos onto a tablet rather than the monitor. Because when a patient is looking at the monitor, it's a passive experience. However, when they're holding the tablet in their lap and they can manipulate the tablet by zooming in or flicking their finger to see the next photo, it becomes an interactive experience. And the interactive experience will often produce a much better result because they're engaged in it. They get in those photos. They get into those photos. If they're looking at it on a monitor, they may or may not register as much information because there's no ability for them to manipulate that monitor right there, and it becomes passive. But if it's sitting in their lap and they take their fingers, they can pinch out and zoom in to infinity, it might create a whole new world of discovery for them. It might make all the, to stick with the theme, makes all the difference. That might make all the difference in terms of the patient fully seeing what's going on in their mouth. And I'm going to go one more step on this ingredient. Make an excuse to leave the patient alone with the tablet. So again, Naren, if you're the patient, I'm going to give you the tablet. So Naren, you probably remember when I took these photos earlier of you today. I went ahead and uploaded in the tablet. I hand you the tablet. Naren, it works just like your smartphone. If you want to see the next photo, just take your finger and flick it. If you want to zoom in, just take your fingers like you do on your smartphone and pinch outward, and you can zoom into infinity. Now here's the theatric part. Now I'm going to make an excuse to leave the room so I can leave the patient alone with the tablet. Naren, doctor and I need to take a minute and look at your digital radiographs. While we're doing that, would you do me a favor and take a look at these photos and make a mental note of any questions you have? When doctor and I come back in the room, we'll be happy to answer any questions you have. So I actually added 2 missing ingredients there, Naren. Uploading the photos to a tablet and making the excuse to leave the room. Watch what happens, doctor, when you start to do that. Patients will totally, when they're left alone, what's everyone's favorite topic, Naren?
Me.
Themselves.
Themselves, yeah.
And they're in your office and they get to see their teeth in a way they've never seen before. They typically get into those photos.